Brian Fallon, her spokesman, says she has no underlying health condition. Now, I mean, that's the big question that everybody really wants the answer to in all of this. What's your takeaway from her report and from that statement?
Well, Martha, you know, the report that came out yesterday was very extensive about the pneumonia, right middle lobe, exactly where it is, which is a very common place, the treatment, Levaquin, a very common antibiotic, the fact that she's recovering, white blood count normal, no fever, she's oxygenating well, all very positive. What was lacking from that report was any mention of that faint or near faint that she sustained that everybody's talking about, previous histories of fainting, or anything about her underlying neurological questions that came up from 2012. So about the pneumonia, it looks like she's doing very well, very convincing, but not a lot about underlying issues.
Yeah. Here's another part of the statement from Lisa Burdak, her physician. The remainder of the physical exam was normal, and she's in excellent mental condition.
Well,
What's your takeaway?
Well, you know, and the other thing to mention is she did reveal in that report that there was a CAT scan done of her sinuses back in March, which also looked at her brain was normal. Not an MRI, but a CAT scan. So that's also very helpful. I want to add, by the way, Martha, there's been a lot of reporting, and even from Mike Emanuel, that Dr. Bardak says it's a non-contagious bacterial pneumonia, but those two words don't go together. If it's a bacterial pneumonia, we are always concerned about the possibility of it being contagious. We don't know. After you've been on antibiotics for a few days, we breathe a sigh of relief that it's less and less contagious.
All right. So your takeaway from the totality of what we've been told on the Clinton side is that there's nothing new here, and do you believe Fallon when he says there's no underlying medical health condition?
I want to see records. I mean, I think that she's doing very well in terms of the infection, but I would like, as with John McCain, to see more health records about her previous history.